global health crisis. Less than 90 years have passed since antibiotics were first discovered and utilised. However, it is predicted that in less than 10 years, once again, minor operations, common sicknesses and infections may be fatal. Antibiotic resistance has steadily continued to render common antibiotic use ineffective. Surf Fleming recognised the potential negative aspects of using antibiotics indiscriminately, urging patients to only use antibiotics when necessary, when it is proven they will actually work, and to never use too little or for too short a time. These conditions encourage the resistance of bacteria to antibiotics. Bacteria rapidly evolve, aiding the development of unique mutations, such as antibiotic resistance. When these bacteria are exposed to antibiotics, susceptible species are supplanted by more resistant strains. Natural selection favours the resistant bacteria, enabling them to survive and reproduce, having a higher survival rate. The resistant strains are able to encode the resistant gene onto transferable plasmids and transposons. Due to the nature of the bacterial cell wall, gram-positive bacteria are sensitive to antibiotics, having a thick peptidoglycan layer, which antibiotics are able to penetrate and disintegrate, whereas commonly gram-negative bacteria are not affected by antibiotics. The World Health Organization has recently issued a report on the seriousness of antibiotic resistance, a global health crisis. In the report, it notes an example where over 1 million people worldwide are infected with gonorrhea daily, an STD which was once able to be effectively cured using penicillin. However, in at least 10 countries, it has been confirmed that last resort antibiotic treatments have failed. Gonorrhea is now unable to be easily treated in these countries. The more antibiotics dispensed, the more opportunities the bacteria have to mutate and become resistant. Counties Manukau has the highest percentage of antibiotics dispensed. This high antibiotic use is of concern, as up to 50% of all antibiotics prescribed are not needed or are not prescribed effectively. New Zealand hospitals have had sporadic cases of superbugs, for instance ESBL, but due to stringent protocols and hygiene regulations, they have helped control the growth of superbugs. No one enjoys being ill, and antibiotics are probably one of the most well-known medicines available. I asked about 50 people in my community, and none of them took antibiotics as prescribed or understood how superbugs developed. Education is required in teaching people the importance of controlling superbugs, and appropriate use of antibiotics, completing the course, and not giving medicine to other family members or their cat, as one friend of ours did, saving the medicine for later illnesses, and not demanding antibiotics for use in viral infections where antibiotics are not effective. Every doctor's surgery, every hospital ward, every healthcare provider, every school should have a poster on the wall educating, targeting by relevant messages, different groups in society, educating them on the importance of only taking antibiotics when necessary, and if taking antibiotics, then completing the full course when started. A nationwide educational campaign is required. Television, papers, newspapers, everyone needs to be involved. Many people stop taking the penicillin as soon as they feel better. However, this has not killed all the bacteria and allows the harmful bacteria to mutate to resistant forms in response to the low levels of antibiotic taken. Doctors need to be allowed to say no and offer other medicine to help patients get better faster. Elixirs for flus and colds. Patients and parents want something. Doctors also need to be monitored on how many antibiotics are given out. Pharmacists need to include an information sheet and a quick explanation with every prescription given out. Antibiotic resistance causes people to be sick for longer and increases the risk of death. Antibiotic resistance also increases the cost of healthcare, with lengthier stays in hospital and more intensive care required. Preventing infection and appropriate use of antibiotics are two key ways of fighting antibiotic resistance. There are numerous benefits for encouraging awareness about antibiotic resistance. Economic and social benefits include less deaths, medication, less time off work, less spending on healthcare, and the slowing of the growth of superbugs. The benefits are also also environmental, where there will be less antibiotic pollution in systems and less antibiotic-resistant bacteria which may further mutate. Costs will include those needed for advertisement, and these will include advertisement and education in the health sectors. In educating the public on the importance of controlling superbugs, the speed of proliferation and imminent onset of complete antibiotic resistance will be slowed, allowing science desperately needed time to develop new treatments with which to replace currently prescribed antibiotics. In the last 30 years, no new major types of antibiotics have been developed. Superbugs. What doesn't kill them makes them stronger. Thank you.